I'm Vikram. I'm co-founder of Multiplier AI. We are a 70 people team working with pharma clients such as Galderma, Abbott, Medtronic, Merck in 9 countries, including US and India. And my background has been a mix IIT, IM, and then worked extensively for large data analytics projects or big data marketing for clients such as Microsoft, and then had a small accident. Was going to one of the largest hospital chains and asked them that if you can give me data, I can help you segment people and predict whom to engage with on the marketing side. And because there was a lot of resistance on being able to even try out anything related to data-driven marketing, I realized that this industry is the right one to target. What does Multiplier AI do, and what problem does it solve? Okay, so we bring Gen AI and data-driven marketing to the conventional pharma omni-channel marketing. So what that means is pharma has a regular summarization of marketing, which is about how do you get what to do, which is the right doctor to target, what is the right message, and what is the right time. Now, what's happened in the now, supposing, for example, if you were launching a COVID vaccine, and I use the example of a COVID vaccine because all of us can understand the problem. Now, if you were deciding what to do with your product, you would, and your agency or your tool came with that there are 1 million people who talked about COVID vaccine, really that would be noise. So what Multiplier does is it's able to pick first the what to do, which means it has a tool which dives into all of this tweets and conversations that has happened and is able to filter them out and say only 200 were from pulmonologists, another 500 were from family physicians, and 2 were from people who wrote the guidelines related to vaccine, and they were negative or positive, hence you need to do something. We also tell that another 5,000 were from patients, so probably that's an experience you need to give weightage to. So what we do is we combine social listening and data sets to be able to tell the omni-channel marketer what to do based on all the intelligence that is there in the world. And you have a ChatGPT-like interface, so you can ask conversation. Now, once you've identified what to do, you want to be able to select the right physicians. And because A, resources are limited, B, because when you are reaching out on channels, you have to select channel affinity, what is the message to the physicians. So we have another tool that does detailed doctor profiling and gets you deep insights. For example, if you are using open payments data, the data is probably 1.5 years old. So we have models that predict, is the physician likely to be in favor of a particular line of treatment? Is the physician likely to be pro or against a particular brand or have a particular sentiment on that? So the second tool is advanced doctor profiling. We help better selection of physicians. The third thing is about how do you get the message across in omnichannel. The way to influence a clinician is when other clinicians are talking very positively about what intervention can be done in the disease state and what are the options about it. So a lot of this is done conventionally in the current world by having a congress where all the clinicians come, present their details and others, and post-congress, there's a lot of silence. So the third module of this entire Gen AI-based influencer marketing stack is a full physician-only influencer marketing platform. What that means is you would be able to select the digital opinion leaders and be able to send a message in the format that would be helping them communicate about the disease state. So that's the third module. It's a full channel where you can reach across select your physician advocates and reach across. It also allows you to be able to select your patient advocates and reach across to them. So for omni-channel, this is worldwide a completely new channel that is available for us. And last is we give this also in a model, and that is a flexible model, which means you could take them as a remote teams, you could take them as just the tool set, or you could take them on a performance-based model where we bring in an ability to run the entire activity for you on a semi-performance model. So that's about Multiplier AI. And yeah, the kind of talent we hire, first set is the teams that are directly interfacing with the clients, which is a customer success slash account management teams. These are viewed as consultants, and these have to be very strong in both the digital and the data analytics slash AI tools, as well as the domain knowledge. So the second set is people who are actually delivering on refining the product and building the product and ensuring the client results are on track and delivered. So this set of people is ones that are more operations, but with that learning on the digital and the domain. Okay. So that's in brief. Okay. Uh, Broadly, I mean, what challenges we face? I think the number one challenge that we face is that um, while everybody has a base level in digital, the first thing we look for is do they like to be in that industry? Do they like pharma? Do they like healthcare or not? And if that's not an industry that they want to be in or enjoy, then it does not matter what their digital knowledge is, because they would not be resonating with that it's a pain of the patient, it's something that's preventing a doctor from delivering a solution. So that's for us the core. First step one of any discussion is this person wanting to be in this industry solving this problem? Second is in terms of the problem, and that is where we differ. For us, Gen AI comes third, and you'll be surprised on it. But the second one is, are there people who are really looking at disrupting, which means showing clear revenue results? For us, digital disruption is not about turning the thing upside down and calling it disruption. It is that the client was getting X revenue, and we are able to multiply that revenue. So is this person somebody who really feels that the numbers can be doubled or tripled? So if that approach is not there, that becomes a challenge, and that's our biggest challenge in hiring, because a lot of people who like pharma are used to a particular pace of growth and results, which really is not what Multiplier is about. So that's the second challenge. Are they willing to look at, for example, for most of our clients, we deliver by Excel sheet, which means for one of our top clients, we have that X amount of revenue per day would come from prescriptions across. And we take very large and significant. That mindset of closing the loop and having a revenue number is extremely tough in life sciences industry. And that becomes and is extremely tough for a lot of people who come from content and branding and that kind. But yes, the best folks come with prior experience. The third is about Gen AI, where we are looking at somebody who is really very comfortable diving deep in data. It can be claims data, it can be social listening data, and within that, they are very, very comfortable with um, picking up the tools. Okay, so what's changed in the last 6 months to 1 year is the tools have done a generation leap, and they are doing that leap every 3 months to 1 year. 3 months to 6 months. So if you are not somebody who can in 2 minutes draft out an updated version of a PPT on a base topic using a tool and would instant want to spend 2 months on it, that's something that's a deal breaker for us, because we feel the pace of change has changed, and only people who are fairly data driven and technical in terms of experimenting tools, they don't need to be programmers, are ones who will be there. So the big challenge is getting this combination of skills and interest. Omni-channel digital marketing is a team sport. So what that means is, within the team, there has to be people who understand what is the patient journey and what is the what is the mindset of a customer, a physician that is there, and that is where the clinical persons have an advantage. So within the clinical persons, and I'm slightly um, opinionated on it. Okay, I think so. While they are a vital part of it. Some of the clinicians want to be more practicing, and some of them want to be doing data and digital solutions and want to be working. The second category is one which is probably a better fit for us. And the good part is, I think a lot of clinicians are extremely clear whether they want to be on the practice side of it, or on a large organization side of it, or on the disruption side of it. There are two roles. One is where you are looking at somebody with a junior experience, and when you're looking at a senior experience. Senior experience, you want somebody who has lived that role, worked that role, because you want the person to go to the better than industry level. Where you're looking at more junior roles, and I think what's changed for us is within the industry, there is less and less of junior roles for the kind of projects that we are delivering. The within the junior roles, you look for a can-do attitude, which means can do in, again, the three dimensions. If the person does not have the clinical expertise, they should be able to pick a CAR T therapy write up and be able to explain using simple resources which are publicly available what a CAR T therapy basic is. Okay, so a can do for picking up clinical learning, a can do for being able to pick up what is the data related or tool set related learning. So these are things that are kind of critical for us, and a can do for being able to deliver client revenue numbers, because there are a lot of people who do not understand or do not believe that within pharma marketing you should or you should own the revenue number, and that is probably a bigger deal breaker than prior knowledge. So having an attitude that you can drive large revenue numbers is a prerequisite. I think retention when you are ahead in the industry is always something that is worse. So the secret sauce is what we have discovered is three things. One is every 6 months you have to be reinventing the company. So pretty much people that worked for us 2 years ago would not be able to deliver in the kind of company that we are today. Okay, so if you are not reinventing and going to the next level, okay, that is when you need to be more worried on the work. Second is, I think what we've come to believe is that, I mean, uh, some attrition is good, right? There are people who want to stay and do this kind of it, learning part of it. There are some people who want to probably take it easy, go in a large setup environment, do something else in life. So from our side, it is very clear. I mean, a person who's motivated to stay on is probably more valuable than a person who wants to move on. We just want to ensure that any of these things are such that clients are not damaged or other things are there. So that's the third thing is, I think we have been we have not gone and oversold our plans internally, because we believe in being ground to earth, but that's been something that has changed. I think now we are probably more conscious about sharing the company roadmap and their learning roadmap and their growth for the people. So that is where, in the end, it is about, um, are we building something that the customers really want or like? And two is, for the right set of people, have we communicated and worked out a growth path that is there? If some of them uh, uh, want to leave, I think there is, I mean, that's part of a growth journey. What we have realized over the years is that our processes have grown stronger. And even today, when I work with a lot of people who are our star performers, our approach has always been system driven, which means, with no exceptions, uh, anything that we do comes process first, because we want to ensure every customer has the same experience. And even if 50% of the company walks out the next day, okay, the customers should not have any kind of impact or disruption. Okay. So a strong roadmap of being a leader in that industry, which means your core is about that. Yes, you are moving at a faster pace than what other large companies are doing. Second is, you have a clear process, and you have, third thing, which I probably didn't mention, is at all points just assume that for personal reasons or other reasons 20-30% will leave. Have a very strong recruitment team in place. Do not compromise on the quality of recruitment team. So two things, I think, pretty much. So three things are there. I think the other thing, first, is that it is extremely important to have industry-based programs. There is no college, there is no curriculum that I've come across in any college worldwide that prepares people for life sciences kind of digital health role that is in the Gen AI world. So first is, I mean, a trained versus a non-trained. It is extremely critical that structured training be done, because at most it will cost you less than what a client uh, would pay for, let's say, a 15 days of work or a week's of work. So structured train, a person who's not trained will destroy every project or will make every project stretch and be less efficient. So for us, first is there has to be a structured training program. Second, in the industry also, we have not found programs that have come from the industry. The gap has been, it's a general SEO, SEM program that is clubbed with one session on healthcare that is clubbed in. So what we have come to realize is that within digital health and within life sciences health, 70% of projects do not meet their results at all. And a lot of it is because they do not know some things which are very unique to the industry. For example, the regulatory landscape, right? You have to work with the regulatory team to roll out life sciences projects. So if you come with from an FMCG industry or even from a nutraceuticals and try to implement it in this, those will hit a bottleneck, if not penalties for your employer. So structured training from industry is very, very essential, and there's a big dearth of it. So that's what I would want in this kind of way. So fundamentally, life sciences marketing is again about having one within the healthcare ecosystem, having an understanding of the ecosystem and what are you trying to do with the core communication, which means what's the communication ecosystem within that digital health. What is the customer, right? You have to define. If you are not able to at the start write very clearly what's the target customer, what's their journey, how do they evolve, interact with other players, then knowing tools will not help you develop better. You may know the best healthcare programmatic tools, but if you're not strong on your basics of what are the personas you're targeting, how is their journeys, what are their needs, what are their preferences, it will become a big challenge. Okay. And this whole thing has to be put together in a strategy. The challenge is there is a lot of templates and others which GPT can not give to you compared to somebody from the industry who has been running it. Okay, when you're doing a course, the bigger takeaway is two things. One is doing things in a structured way. Second is a mindset. Okay, if you do not have the right templates and other things in a structured way, okay, you would spend years trying to learn it at the cost of your company. The second thing is about the mindset, because life sciences marketing or even broader digital health related or healthcare related, provider related marketing requires you to have a particular approach to who's the stakeholder, whether the message will resonate with them and others. These things are once that you learn what are the channels that will work, what are the channels that may not work, because channel selection comes from past experience, which is again a function of the industry. How do you build content? How do you kind of understand? How do you mine for what is it that? How does reputation establish trust? Right? A lot of us took a particular vaccine and did not take a particular vaccine because of a particular opinion on them, which was possibly heavily shaped without the science behind it. Then it is about data. Digital has grown beyond just saying what to do to taking the data, merging data from multiple sources, and validating whether your strategy and your is data driven and whether your results are coming in or not. It doesn't matter how good the strategy, sometimes it doesn't work. If you are not comfortable or not done a course where you have gone through the data, it becomes a huge challenge. You have to understand how the ecosystem works. If you have not understood how metrics, how KPIs have to be set up, and you are not able to come with the right KPIs for the industry, you can't pick something that may be right for maybe providers or maybe um, a pair and plug them into life sciences. The KPIs will be different. You can't pick something that is from, uh, uh, prescription brands and kind of plug it into brands that are for a different channel or others. And last is about, what are the trends? There is a huge change that is happening. You've got Apple coming up with their own set of diagnostics. You've got Google doing something. You've got Amazon across globe having more and more of pharmaceutical products on with prescription available on its platform. So there is a huge disruption that's going to happen. So either you get a structured program that in a period of time gets this to you, or you learn at the cost of your company or by trial and error. So these are the things that I would look for in a program.